Are you curious about regrowing your hair if you experience hair loss in the last year? And what are the peptides that are best for hair thinning and hair loss? In this video, I'm going to cover the top 3 strategies that I found helpful working with patients as a doctor to help regrow your hair. Hi, I'm Dr. Amber, and on the channel, we talk about all things peptides. So let's dive in. Here are the 3 strategies in order. First, we're going to talk about assessments and lab testing that you should do to really prepare and get some knowledge of nutritional deficiencies. And this is really stage 1. So like week 1 through 4, you really want to focus on looking into deficiencies or hormone levels. And of course, medical disclaimer, this channel and all of the content in these videos is designed to entertain and educate you. And none of this is personalized medical recommendation. Please work with your doctor, speak with your doctor before you incorporate any recommendations. So week 1 through 4 on your 12-week journey is really going to focus on running lab testing and getting some assessments to figure out if you're deficient in some of these key nutrients for hair growth, as well as what are your hormone levels that could be contributing to some of the hair thinning and hair loss. Next, we're going to talk about lifestyle and diet. And this is really weeks 5 through 9 where you want to focus more on different factors in your lifestyle and improving nutrition, things in diet that you can include or not include to help regrow your hair. And then finally, strategy 3, in week 10 through 12, you want to focus more on some of these alternative treatments that can really help, like peptides, microneedling. We'll dive in more there. So let's get started. When we're thinking about lab testing and certain nutrients to look into, we really want to look into some of the key nutrients that play a role in hair thinning and hair loss. And so iron is a big one, right? Iron is used to carry oxygen around the body. And if we don't have enough iron stores in the body, like somebody who is anemic, we may not be able to actually deliver oxygen and nutrients to the hair follicle. And so that can cause hair thinning and hair loss. The other common place you see this is in more of a vegan or vegetarian diet where you can run low on iron levels. Or women who are menstruating have really heavy cycles, they may be iron depleted as well. Women who are pregnant, iron is really important. Zinc is another one. Zinc is really pivotal for not only immune function, but also for keratin production, which is really the protein that our hair is made from. Zinc helps to keep the glands around the hair follicle functioning properly, so zinc is quintessential. I also like to look into other nutrients like selenium, biotin, which is that B vitamin, vitamin B7, which helps with hair growth, healthy nails. And then, of course, we want to run a full hormone panel, and that involves looking at testosterone, which testosterone can be problematic. It's one of the leading causes of hair thinning, hair loss if it's elevated, especially in women, but also in men. So that androgenic alopecia, meaning it's caused by androgens like testosterone or some of the metabolites of testosterone being elevated and then leading to that male pattern balding, which is thinning in the temples and then also on the crown of the head. It's also pivotal to look at your thyroid, full thyroid panel to see if anything is going on. So if you're hypothyroid or hyperthyroid, meaning high or low thyroid hormone, you may experience hair thinning and hair loss. So these are really pivotal markers to look into. And I like looking at total T4, total T3, free T3, free T4, TSH, reverse T3. If you look into a full thyroid panel, it's a little more comprehensive than what's typically run. So a lot of these nutrients, we could test B vitamins like B12, but also I'd like to run testing that looks at more of these chronic infections that could cause stress to the body and therefore contribute to hair thinning and hair loss, and also heavy metals, right? So we know that mercury, excessive mercury in the body or exposure can really affect hair thinning and hair loss. So that's just one example of a heavy metal that many people could get through eating a lot of seafood, sushi, frequent consumption. And if mercury is high, that's going to be a problem as far as hair growth. So there's a great company called True Health Labs, which actually allows you to go and order your own panel of some of these labs that we talked about. So I'm going to post that link below if you're curious. Of course, work with your practitioner, but this is just a resource for you. So let's talk about the top 3 common causes of hair thinning and hair loss. First one is androgenic alopecia. This is a really huge percentage of people, and that's where the testosterone levels are elevated. And this can happen in men and women. The second is poor nutrition. So just a diet lacking in some of these key nutrients like iron, like zinc, and then the quintessential one, protein, which gives us those amino acids that are building blocks for hair, for connective tissue. Next, we have hormonal imbalances, usually due to stress. Who doesn't have stress, right? So high cortisol production. We know that there's receptors in the hair follicle for cortisol. So when we're under high levels of stress, that's why our hair can fall out. And usually that happens within a few months after that stressful event. And the last one is really chronic infection. So what we saw with the vid recently is a lot of people were dealing with hair thinning and hair loss after getting a viral, bacterial, some sort of infection, right? And this could be candida overgrowth, mold exposure, could be a viral, bacterial situation, HPV, H. pylori, any of these chronic infections would fit the list. And the way that they would impact hair growth is they're essentially robbing some of those critical nutrients like zinc, like iron, vitamin D, these B vitamins that our body would use for building and creating healthy hair. They'll rob those nutrients away. Next, let's talk about lifestyle and diet. And this is really a focus for weeks 5 through 9. And so many people have a very high stress lifestyle. They're not sleeping enough. We know that sleep is when your cells repair. So it's really critical to get that 7 to 9 hours. Most people need around 8. And that means you're in bed for at least 9 hours to get 8 hours of actual sleep. And then I think about the environment that you're living in. How clean is the air? How pure is the water? If you're drinking tap water, we'll post a resource below. It's EWG. You can actually check what's in your tap water. And those are really easy, low-hanging fruit here, right? Clean up the water, clean up the air. And I'll also share my favorite water filter, which is called the AquaTrue. It's a reverse osmosis system, so you just have to add minerals back in. And again, we need minerals for healthy hair growth. There's an air purifier that I love to use, that I use in my own home. It's called the Air Doctor, and there's lots of different sizes of it depending on if you want it to clean one room or your whole house. And so I'll also post that link in the description of the video if you're interested in taking those steps to clean up your environment. And then one of the big things for me is really finding a job or a work life, if you're self-employed or an entrepreneur, where it's either hybrid or remote. I think this makes a huge difference in your stress level. And we know that stress really contributes to hair thinning and hair loss. And so if you're not having to fight that morning commute, you're not having to double caffeinate to try and stay awake through the afternoon, you're kind of able to work on more of your own ideal, optimal energy schedule throughout the day. That makes a huge difference. Would love to hear your thoughts about that in the comments too, if you have a similar experience. And then focusing on diet, more of a anti-inflammatory Mediterranean diet. So a lot of those healthy fats, coconut oil, olive oil, avocado oil, avoiding all the inflammatory fats, and then adding in some lean, healthy protein is phenomenal, because again, we need those amino acids as building blocks. And then the rest, really focusing on micronutrients. So tons of colors in your food, fruits and vegetables that have these rich pigments like purple and red and yellow, right? Think about yellow peppers and carrots that are bright orange. And really, we are a country that is, over fat but undernourished. We are getting tons of calories but not a lot of nutrition. And so really pivotal that your body needs these nutrients. Maybe we can't get them all through our food anymore because our soil is depleted, right? So if you've been in the health world for any period of time, you know that. And so that's why it's really pivotal to take a multivitamin. For a woman, a really good prenatal can be your best multivitamin. And really, I know I'm going to get some flack for this, but that vegetarian vegan diet is really not going to support hair growth in the long run. Many times you'll notice hair thinning and hair loss later on. Some people who switch to that vegetarian vegan diet immediately feel like their hair is healthier or maybe thicker, but in the long run, it will thin out because you need amino acids to repair. And then also lack of iron, lack of B12, some of these other critical nutrients you need for hair growth are not represented in that vegetarian vegan diet. So when we say a higher protein diet, we mean up to 1 gram of protein per pound of body weight. And that can be a lot. One of the easy things that I do is I add collagen protein to my coffee in the morning, to my 1 cup of coffee a day, and that can really help. That's 20 grams of protein, right? And so finding ways to sneak in protein into your foods, into protein shakes, into snacks is a really good way to up that protein, those amino acids for repair. This also helps with iron levels too, eating more high protein diet, right? So we know that there's actually receptors, again, in the hair follicle for ferritin and iron. So if we're depleted in these, it's going to definitely impact our hair growth. The other 2 nutrients that we haven't really touched on is vitamin C and vitamin D. And vitamin C, in one study, actually showed that women felt lower levels of perceived stress just from vitamin C alone, which is amazing. So if you're under stress, you take vitamin C, you feel physically less stressed, because the adrenals need that vitamin C. Vitamin C really helps the skin, it helps the hair. It's just a powerful antioxidant, so love that one. And then vitamin D is that fat-soluble vitamin that's really pivotal as well. And a lot of people are low in vitamin D, so we need to increase vitamin D, sometimes through supplementation. There's a lot of foods that are high in vitamin D as well. Okay, so now let's talk about all of the fun stuff, all the peptides, all of the alternative treatments, the exciting pieces that we can add in to help with hair thinning and hair loss and help reverse that. And so there's many peptides that help here. Some of my favorites are BPC-157 or body protection compound. I'll link it in the description. Copper peptides are really valuable. So that's the GHK-cu. Cu stands for copper, right? We know copper is really a critical nutrient in rebuilding collagen and hair growth as well. And that one helps more with blood flow to the hair follicle. Really, really helpful. And then thymosin beta-4 can be helpful as well. These could be in a medical practice injected into the scalp to improve hair thinning and hair loss with numbing, of course, because that is quite painful. But you can also use these topically. There's some blends that I love to use that are available that you can apply topically from home that are really inexpensive. We'll talk more about those. So BPC-157, that one really increases nitric oxide. If you know about nitric oxide, it's for better workouts, better erections, right? It's for better skin, better blood flow. And so it also, for the same reason, it improves blood flow to the scalp. So that's really great. BPC is cytoprotective, meaning it protects the cell, it helps with blood flow. It actually increases the expression of these growth hormone receptors. So this is one of my favorite pro tips in peptides. If you take BPC with something like CJC ipamorelin, sermorelin, anything that improves growth hormone, any other peptide that works there, you're going to see a better effect. That's a synergy, a great combination. The copper peptides, they really help with angiogenesis, so building new blood vessels. They help to lengthen that anagen or that growth phase of the hair follicle. Copper peptides are anti-inflammatory, right? They help with that DHT level, that dihydrotestosterone, the really active form of testosterone that could cause hair thinning and hair loss. They help with stem cell activation and migration, which is really also helpful for hair growth. They increase the subcutaneous fat. It decreases this pro-inflammatory cytokine called IL-6. And the copper peptides are really comparable to minoxidil, which is a common prescription product sometimes used for hair thinning and hair loss. One of the other things that's really cool about copper peptides is that they upregulate SOD, which stands for superoxide dismutase. And this is a really important antioxidant in the body. It's a scavenger. So if there's a lot of inflammation, there's a lot of chronic infection happening, superoxide dismutase can help. The other peptide I mentioned is TB4 or thymosin beta-4. And again, this is made by your own thymus gland. Thymosin beta-4 has a lot of the same benefits as the copper peptides. It helps to lengthen that anagen phase, right, which is that growth phase of hair, and shorten the telogen phase. It promotes wound healing. It helps with decreasing death of stem cells, so it's going to preserve stem cells, and then it can also decrease some of that inflammation locally. has this anti-inflammatory effect, which I love about the thymosin peptides. So these peptides can be taken orally. There's capsule forms of these. There's also topical versions of these. There's a couple other peptides, one's called PTD-DBM that can be used, but the copper peptides are really my favorite. So I'll link those in the description if you're curious about this blend that's used. There's 2 droppers, and essentially you apply them both to the scalp at night before bed, massage them into the scalp because we know scalp massage can improve circulation and also help with hair growth. And that's a really good at-home protocol. I like the internal and external approach. I think addressing just the external tends to not really resolve the problem. So that's why we talk about all these nutrients and diet changes and lifestyle to help keep healthy hair. The other at-home thing you could do is red light therapy. So you can get a red light therapy box. I have one that I use, and you can actually put it right on the scalp. There's these red light caps that you can buy now, but the box works just fine because you can apply it to different areas. You can apply it to the face, and it helps with collagen synthesis. It helps with mitochondria, and so it's a way to stimulate hair growth. Again, all you really need is about 10 to 15 minutes a day. It's also been shown to red light therapy can help with boosting melatonin levels at night. So you could do that at night in your evening routine, or some people do it in the morning where it helps with the hair growth. And the last pro tip I'm going to give you is microneedling. This is a really awesome thing. It can be done from home. A lot of clinics also will do this, and they'll numb the scalp and they'll go a lot deeper and be able to inject peptides and do a lot of advanced hair regrowth techniques in office. But you can microneedle the scalp at home, and you can buy a kit on Amazon, a microneedling kit that can be used with some of these topical peptides that I mentioned to really improve hair growth in the scalp. So the micro trauma, right, that happens from microneedling can really help with the hair growth. And then you're putting some sort of growth agent or something that reduces inflammation, helps with hair growth. The copper peptides, for example, helps with blood flow. Applying that directly after microneedling or during can really drive it into the tissues and improve the absorption into the hair follicle. So I hope you found this helpful. This is a ton of information. And if you're interested in learning more about holistic hair growth as well as peptide therapy, definitely subscribe to the channel. Click a like on this video so that more people can see it and share it out. Remember, transforming your hair and your health is definitely within reach. And these are some of the strategies and tips that you can use to help expedite that process. I hope the next 12 weeks is transformational for you as you incorporate some of these. And something might have come up for you as you were listening to this video, questions or other things you want to learn about hair growth, hair thinning, hair loss. Definitely post those in the comments. Happy to answer those in a future video. So please feel free to share this video with anybody that you might think would benefit from this holistic hair regrowth journey. And I would be so grateful. Thank you for tuning into the channel. So happy to have you here, and we'll see you in the next video. Until next time, stay positive and stay dedicated to your health and well-being. If you found this video insightful, you might find this video also very interesting.